we partner with Franklin County Health Department to do this. And this is on a different subject in the health field. Today, our guest, we're very excited to have Marie Winfrey, and she is the Harm Reduction Syringe Exchange Program Coordinator with the Franklin County Health Department. And we're so excited to have you here, Marie. Are you excited to be here?
Thank you. Yes, I am excited.
So I want you to start out by telling us about the Syringe Exchange Harm Reduction Program.
Okay, yes, sure. And first, thank you for having me. I'm really excited to talk about our Syringe Exchange Program. But before I start talking about the Syringe Exchange Program, I really feel it's important to talk a little bit about what is harm reduction. And what I like to use as a definition for harm reduction is a set of ideas aimed at reducing negative consequences associated with substance use for individuals, their families, communities, by meeting people where they are. This extends to many services. It includes disease prevention, syringe exchange, safer use practices, and linking people to housing, food access, insurance, medical care, substance use treatment, and behavioral health services. Harm reduction practices are used every day by everybody, like nutrition, exercise, education, seat belts, vaccines, and sunscreen.
So you mentioned lots of things as part of that program, right? That the health department is supporting, and specifically, you mentioned syringe exchange. That's something that you guys are taking seriously. And can you talk about what that program looks like for folks here in Franklin County?
Yeah. Well, I feel like knowing the harm reduction and syringe exchange is kind of one, and they go hand in hand. And I feel like knowing this is important because this is exactly what our syringe exchange program does for our participants and our community. By providing clean supplies to our participants, we're preventing the need to share supplies, and that's reducing the risk of spreading HIV and Hep C. Last year, we gave out 211,187 clean syringes, and we received 183,452 used needles were returned. And that is giving us an 87% return rate. And I feel like if our syringe exchange program was not in place, we would have the potential of having those used needles in our community instead of being safely disposed of.
So that demonstrates the importance of this program for sure.
Most definitely.
Because again, we don't want those needles out in the community. So it's good that you have this program. So what are some other reasons why it's important to have this in our community?
Well, we give a lot of other resources. So each participant is offered HIV and Hep C testing each time they come in. If any one of our participants are positive for Hep C, hepatitis C, that is, we have nurse practitioners on staff that can treat that at a 95% a cure rate, and and at 8 to 12 weeks. So that's really huge in itself. We also give naloxone and overdose. We also give naloxone, which is an overdose medication, reversal medication. Last year we gave out 1,868 naloxone. We also created a link for the community. For anyone that is interested in getting naloxone can go and watch a short video, answer a few questions, and put in their mailing address, and they will receive a free dose of Narcan by mail. We provide condoms, education on safe sex, education on wound care. We also provide COVID-19 shots for our participants. We've partnered with the Emergency Food Pantry and the Mission Clinic to give our participants that are food insecure food. And we also can give winter gear and hygiene kits as well. We have partnered with Voices of Hope, which is a peer-led recovery community organization that values all pathways to recovery. This does include harm reduction, and we're fortunate enough to have Jimmy Chadwell with us every day that the syringe exchange is open. And that is Monday through Friday from 12 to 3 p.m. And they offer several other services. And I believe Jimmy Chadwell's going to be here later on this month, and he can tell you a lot what they do and some of the things that he does.
It's so interesting. You touched on it, about harm reduction, but then the fact that you have the opportunity to connect with people when they come, right, to provide them additional education or resources or medical assistance or anything like that. And that's not happening probably enough as it is. And so having that new channel to be able to do that, I think is probably great for the community.
It is. It's really good. It's really building relationships with these individuals that come. So when they're ready for other levels of care, they trust us enough to come, and we can do that for them. So it's great. I love it.
Yeah.
And again, besides building the relationships with the people who come in, that you all are forming partnerships with other organizations to provide like a united front to a comprehensive approach to helping the people in our community, and I think that's great.
Yeah.
Thank you.
So what do we need to let people know about? Or you mentioned 12 to 3 Monday through Friday. Is that
12 to 3? Right, 12 to 3 Monday through Friday, and we are located at 100 Glens Creek Road, and that's at downtown.
Okay.
Did we mention the free Narcan?
There is a link.
Okay.
Do we have that on the screen?
It is. It's on the screen.
Okay. You go there, and it takes you right there. You can watch the video right there.
Awesome.
All right.
Marie,
That's fchd.org/free Narcan.
Yeah. Marie, thanks so much for coming to visit. And we look
Painless,
forward-
right?
Yeah.
Painless.
She was
Thank
great.
you.
Oh,
Thank you for having me.
Let me share with you
Yes.
that we had a comment about you
Oh.
from one of our viewers.
Okay.
Oh,
Kathy Jennings says Marie is awesome. She really cares about people she works with.
Awesome.
thank
Well,
you.
thanks so much, Marie.
Yay.
Thank you so much for being here, Marie. And, we look forward to having you back sometime. Tell us how things are going.
Thank you. I look forward to it.
All right.
All right.